Raywat, we spoke a couple of months ago about the bird flu, and at that time you were saying, well, I'll reserve judgment, see where this is going. Well, we've seen it in the United States, so much so that it has transferred to many other animal types. And in some cases, humans. We've had a case in BC. We've seen a run on eggs. We've seen all sorts of issues there. Where are we at now on the bird flu in the United States and in Canada? And are we nearing, and could this turn into a pandemic?
Okay, big questions. First, where are we? In the USA, nobody knows for sure. And we'll talk about this, I'm sure, because of the data sharing issues that are subsequent to the new administration taking power. But it looks like we have evidence that it is spreading to humans more commonly than we first thought from association with animals, asymptomatically so, which is interesting and probably good because it means it's not quite as lethal as we thought, but still a dangerous thing. And it's making into many more bird populations, leading to more cullings. So its reach is much further along than it was last time we spoke. And so the threat of a pandemic level response is real, and more so than a few months ago. So will it make the jump into sustained human-to-human transmission? Still an unknown, but it is more likely now than ever before.
Talk to us about the surveillance issues in the United States and what we potentially don't know.
So our single biggest weapon, excuse me, against this is information. And information sharing between scientists, between policymakers, and with the public. And with the new administration coming in, they have made it a priority to curtail all sharing of information across the board with the public, across all federal agencies, including CDC and other health agencies. So it is difficult to get solid information now, except that which is shared directly between scientists. So
is it impossible in the sense that what I'm hearing now is that scientists are sharing this information. Depending on what state you're in, you can share that information, and institutions are filling that breach as best as possible.
Exactly right. So it is inconsistent, and it's a patchwork of quality of surveillance and data sharing, which is not ideal. This is diseases don't know boundaries. They don't know these artificial geographical borders. So we will not get a good sense of the actual threat as it curtails the Canadian border, So this is concerning. Surveillance has to be our number one priority, because without surveillance, we don't know where to deploy our resources, our assets. We don't know when to invest in more vaccine, which vaccine to invest in, and whether or not to pull the trigger on mass deployment. These are critical choices. And it looks like there isn't a desire amongst policymakers, at least south of the border, to prioritize these issues for decision-making purposes.
The best information we have now, and you mentioned it doesn't look like this is lethal. Explain.
Well, let's be clear what we're saying here. It definitely can be lethal. Previous to this current outbreak, it was thought that the case fatality rate was about 50%. So if you got it, flip a coin, see whether you die or not. But with better surveillance, we're learning more about the asymptomatic cases, which expand the denominator of that ratio. And so it's probably coming down to like 14% fatality, which is still terrifying. It's still terrifying and potentially civilization stopping, right? But that doesn't mean that we should be as existentially terrified of it as we were, say, a few years ago. And the other good news, of course, is that this is the flu. It's not an unknown virus. We understand how to treat it and how to contain it. And we have a vaccine for it as well as treatments. And one of the reasons it's not as fatal as before is we have this excellent treatment called Tamiflu. The problem is there isn't a lot of Tamiflu around. And if this does go epidemic, if it does start to infect tens of thousands, if not hundreds of thousands of people, there may not be enough of that treatment to go around. So there are a lot of issues here, a lot of things to still be afraid of. But you're right, as more data comes in, the case fatality rate has fallen in our estimation.
With Raywat Deonandan from the University of Ottawa, Richard Cloutier reporting on 680 CJOB. Let's cross the border into Canada here. What are we doing as far as surveillance is concerned?
Same thing we always do, which is good news, right? We keeping track of those cases we know about, testing, and I'm not sure, we're doing some ring testing of individuals who were exposed and making sure their contacts were tested as well. But I'm not fully aware of the extent to which we're doing this. And I do know that the data we have available at the federal level is being openly shared to the extent that we have it. So we don't suffer from the same political constraints that the Americans have, but we don't have the resources, frankly, or even though the burden of infection yet. When we do have that burden, then I anticipate all the public health levers to be pulled and full court pressed for data sharing. Currently in Canada, things are well contained.
RFK Jr., Robert Kennedy Jr., is now the new health secretary in the United States. There are some concerns there, a whole host of concerns there. I'm sure you share those concerns. But does this give Canada the opportunity to do even more surveillance, to kind of check what's going on in the United States by emboldening our healthcare systems on this side of the border? Would that help?
Everything helps. And definitely it's a signal for us to rely more and strengthen our own public health infrastructure. That includes surveillance. That includes being transparent with data sharing. It includes keeping our vaccine production facilities live. We cannot rely anymore upon the Americans to be the manufacturing center necessarily. And it also means being responsible for our own data assessment. I do sense that in previous years, we kind of looked at what the Americans were deciding and had that inform to some extent our decision-making processes when it comes to vaccine regulation. We can't do that anymore. We have to be entirely independent or look to other countries to guide us more so. It's also an opportunity to import some brain power from the US of scientists who are fed up there and maybe want a new home. We're happy to become a new biomedical center of excellence globally. But yeah, we definitely have to keep our vaccine platforms alive. It's right now, there does exist a viable vaccine against this disease. It's stockpiled. If the disease mutates, we need to make more of them in new versions. So, and that probably means using the mRNA platform. So there are things that we have to do and be ready to do if and when this thing mutates and makes a jump to sustain human-to-human transmission.
Raywat Deonandan, always appreciate your insights, your analysis. I thank you so very much for joining us.
It's my pleasure. Thank you.